Assalamu alaikum. I am back with two more topics, which is common elbow presentation. So we discuss it as a case scenario. So our first case is 3 years old child, uh, female patient. She father was playing with the child, air swinging him. Then suddenly he heard a click in the elbow, and the baby started crying after that. There is no history of any direct trauma. This means there is no fracture, there is no fall or direct hit to the elbow joint, and there is no fever. This is very important because we need to root out any subclinical infection in the children because infections are very common in children. Okay, so this is a classical presentation of patient who is having pulled elbow. So what is pulled elbow? Pulled elbow, otherwise called as nursemaid elbow. It's a common childhood injury where the radial head subluxate and entangled in the annular ligament. So here, if you see, this is a normal elbow joint with where the capitulum is articulating with the radial head and the annular ligament is holding the proximal radius. Due to this axial traction, the head gets subluxated and the annular ligament get entangled between the capitulum and radial head. So the mechanism of injury is longitudinal pull or traction along the long axis of the radius. And it's more common in female and age between 1 to 4 years of age. So presentation is like a click may be heard by the patient parents or the someone who is taking care of the child. And after that click, child refuses to use the affected limb. And he holds the elbow in slight flexion and forearm is pronated. Physical examination, you find pain and tenderness along the proximal aspect of the lateral elbow, and the range of movement is restricted and the elbow is locked. So the clinical diagnosis is most of the time it's a clinical diagnosis. We do X-ray if we are suspecting the fracture, and the history by the parents or the caretakers is not reliable. We do ultrasound to see the soft tissue to rule out any infection or any other soft tissue injury. The treatment is close reduction, where we do two maneuvers. One is supination technique, other is hyperpronation technique. Supination technique is where we supinate the elbow and flex it. So the radial head will get relocated. The same way, if you hyperpronate the elbow also, the radial head will get relocated. The thing is that once the elbow get reduced or radial head get reduced, patient should have complete relief of pain. If there is some soreness, we can give short-term splint in the form of arm sling to the patient. The second case is second topic is student elbow, otherwise called as olecranon bursitis. So here the case is like a studious student who is sitting in the library, keeping both of his elbows continuously over the table. So this causes irritation of the tip of the elbow, and there is a bursa in between which get inflamed. So it's a student who is sitting in the library for the long time. They started pain along the elbow region. So what is olecranon bursa? Olecranon bursa is a synovial sac. It's above the olecranon tip as a cushion, subcutaneous tissue, and olecranon bone. Inflammation of this sac is olecranon bursitis, otherwise called as student's elbow. If you see here, this is a normal bulge of the olecranon. Here, due to the collection in the olecranon bursa, there is a swelling in the redness. Here, if you can see, it's a normal olecranon bursa. Here, there is an inflammation of bursa and the swelling of the bursa. The causes are infective causes, inflammatory causes, traumatic causes. Infective is systemic infection in immunocompromised patient like diabetes or chronic renal failure or some foreign body inside the bursa. Inflammation is most common either gout, pseudogout, rheumatoid, or diabetes. Traumatic may be following the direct trauma. There may be hematoma which get inflamed or repeated microtrauma as we see in the students who sits continuously keeping the elbow over the table. The clinical presentation is if infection is there, patient will have fever and other symptoms pertaining to the infection. If there is some other disease, there will be having the presentation of systemic disease. If the rheumatoid, there will be deformities of the fingers. If it is gout, there is multiple gouty arthritic changes or subcutaneous gouty nodules. Or if there is pseudo gout, they'll have some other joint presentation. If there is history of trauma, there will be other trauma associated injuries. Diagnosis is most of the time clinical. We do ultrasound for the confirmation. We do blood tests for to rule out other systemic cause like gout, pseudo gout, and rheumatoid pathology. If we are suspecting infection, we need to do aspiration and culture of the fluid. Treatment is if patient is having non-septic bursitis, rest, NSAIDs, aspiration, and steroid injection will do. If it is a septic one, we need to give antibiotic and drainage of the collection inside the bursa. The definitive treatment is excision of bursa. We call it as bursectomy. It can be done either in general anesthesia or local anesthesia. Thank you.